Welcome to the United States Sports Academy, America's Sports University. This is Unit 10 of Math 465, Statistical Measurements in Sports. This unit covers non-parametric statistical techniques. It is important to note that this presentation is simply a summary of the topics covered in Unit 10 and not intended to replace the textbook or any supplemental readings.
Welcome to Unit 10 of Statistical Measurements in Sports. In this unit, you'll learn about clinical measures of association and advanced statistical procedures. Now, there's a lot of information covered in this unit, so I want to give you some direction as what you should focus on. The first thing that you should focus on is learning the key terms in this unit, such as relative risk, odds ratio, sensitivity, and specificity. You also want to be able to learn and discuss some of the advanced statistical procedures covered in this unit, such as meta-analysis and MANOVA. Now, unless you get very involved in the research profession, you're probably not going to be put into a situation where you have to run some of the advanced tests that we're going to discuss in this unit. But it's good that you at least know about it and be able to discuss it, especially when you're reading scholarly research articles. Now, if you have any questions about the topics covered in this unit, please contact your instructor. Thank you.
After successfully completing this unit, you should be able to 1. Understand clinical measures of association and its application in kinesiology and related disciplines. 2. Define relative risk, odds ratio, sensitivity, and specificity. 3. Understand advanced statistical procedures such as A. Meta-analysis, B. MANOVA, C. Factor analysis, D. Discriminant analysis. Clinical measures of association. Here are a few key terms that you should remember in this unit. Relative risk is a ratio of proportions and is also known as the ratio risk. Odds ratio is an index that calculates ratio of odds. Sensitivity is the true positive rate and is an index that quantifies how well a diagnostic test identifies those with the condition. Specificity is the true negative rate and is an index of how well a diagnostic test identifies those without the condition. Advanced statistical procedures. Here are some of the advanced statistical procedures covered in this unit. Meta-analysis, procedure that allows an investigator to statistically combine the results of multiple studies. Multiple analysis of variance, MANOVA, the simultaneous analysis of two or more dependent variables in a research design using analysis of variance. Factor analysis, a statistical technique used to identify the common components, factors, among multiple variables. Discriminant analysis, classification of subjects into like groups based on certain measure-suitable characteristics of the subjects.
When scientists want to get a clear picture of whether a drug works or a particular behavior is linked to a poor health, they need to combine all of the evidence available. However, this will generally not be contained in a single scientific study. Meta-analysis is the science of combining evidence across multiple studies to address a research question as definitively as possible. For example, we might want to ask, does aspirin effectively reduce pain for patients after an operation? To do this, we would need to collect the results of all the clinical trials that have assessed this treatment and combine their results to get an overall picture. We can imagine a meta-analysis as a physical machine that finds the balance or pivot point of a set of weights. In our example, each weight represents a trial that has assessed the use of aspirin. The number of patients in each trial dictates its weight. Studies with few patients are light, whereas studies with many patients are heavy, because larger studies give more precise evidence. The horizontal position of the weight represents the effect estimate from that trial. In this case, the difference in pain reduction for those patients assigned to take aspirin versus those who took placebo. The balance point represents our best guess at the overall effectiveness of aspirin when averaged over all trials. As new evidence accumulates, for example, as the results of a new trial emerges, another weight can be added to our scales to update the balance point. Scientists use graphical plots just like this machine to keep track of the results and explain them to the wider world. However, sometimes the available evidence is biased. For example, a trial's result can affect its chances of being published and put into the public domain. Those that suggest a benefit of a treatment might be more likely to be published than those that don't. This is known as publication bias or the file drawer problem, where results considered less exciting are filed away and never see the light of day. This can sometimes be detected through visualizing the data when it induces asymmetry. We can even try to correct for this kind of a bias By applying statistical techniques to restore symmetry to the data, we can estimate what the true unbiased answer to our research question is most likely to be. Meta-analysis allows scientists to use all available data to arrive at the best possible understanding of what treatments work. Government bodies such as the National Institute for Health and Care Excellence consider findings from meta-analyses the gold standard form of evidence, over and above those from a single study or the personal judgment of experts. They use it to determine how we are cared for across the NHS so that we can lead long and healthy lives. It is the cornerstone of what has become known as evidence-based medicine.
Let's review.